What's up guys, how are you? Today in this video I'll teach you the osteology of scapula. I am giving you the overview of scapula so that it will be easy to understand. There are two surface of scapula, there are three border of scapula and three angle of scapula, and few processes are there. One is the spinous process, acromion process, and last one is the coracoid process. In this way I will read the scapula. First question will be coming in your mind, sir, tell me the or teach me the anatomical position, how I hold the scapula in anatomical position. That video I have already uploaded on the my channel, so you have to see this video on my channel. I will give the link in the description box. Okay, right now I start with the surface of scapula. There are two surfaces of scapula. One is the dorsal surface, that is called the posterior surface. Another is the ventral surface, that is the anterior surface. Ventral surface lie forward while the dorsal surface lie backward. Now come to the dorsal surface. Dorsal surface, as you can see, the dorsal surface is concave forward. The dorsal surface is concave forward. As you can see, there are three ridges are present in the ventral surface of scapula. Are you seeing, guys? No? If you have bone, then you can see that one also. Now come to the ventral surface again. The ventral surface having the fossa-like structure forms concave forward structure, forms the fossa-like structure, that is called subscapularis fossa. What that is called? Subscapularis fossa. At the subscapularis fossa gives the attachment of one muscle, that is called subscapularis muscle. Now come to the dorsal aspect of the scapula. At the dorsal aspect of the scapula get divided into two surface. One is the supraspinatus fossa, other is the infraspinatus fossa. One is the supraspinatus fossa, another is the infraspinatus fossa. Now you can see supra and infraspinatus fossa becomes due to the presence of spinous process of scapula. Means why you call it supraspinatus fossa, because that fossa is present above the spinaceous process. That's why I call the supraspinatus fossa. Again, in the same way, this fossa is present inferior to the spinous process of the scapula. That's why it is called the infraspinatus fossa. Now guys, the supraspinatus fossa covers 1/3 area of the dorsal surface, while the infraspinatus fossa covers the 2/3 area of the dorsal surface. Now come to the muscles attachment on the dorsal surface of scapula. There are total 5 muscles. Get attached on the dorsal surface of the scapula. I am telling you the name. After that, I will mark you that where is the all muscle present. Okay. First muscle is the supraspinatus muscle. Second is the infraspinatus muscle. Third one is the teres minor muscle. Fourth one is the teres major muscle. Fifth one is the latissimus dorsi muscle. Now guys, come to the first muscle. First muscle is the supraspinatus muscle present in the supraspinatus fossa. Second one is the infraspinatus muscle. The infraspinatus muscle present in the infraspinatus fossa. That's simple. The name itself says its origin and all and attachment. Okay. Now come to the all three muscle. That was the teres minor, teres major, and latissimus dorsi. Now, on the dorsal surface of the scapula, as you come laterally, then you will see the three muscle attachment line by line. Okay. First muscle is the teres minor muscle. After that, as the teres minor muscle ends, from that ends one muscle again started, that is the teres major muscle, and just beneath the teres major muscle or just beside the teres major muscle, the last muscle of dorsal surface of scapula, that is the latissimus dorsi muscle. Okay, there are 5 muscles that I have covered. You have to keep in your mind: supraspinatus, infraspinatus, teres minor, teres major, and the latissimus dorsi. Now I will start the borders of the scapula. As I told you earlier, there are total three borders of scapula. See, I will hold the scapula in this way, and this one is the lateral side, this one is the lateral part, this one is the medial part, this one is the superior part, and this one is the inferior part. Now, there are three borders of scapula: superior border, lateral border, and medial border. See, I am moving my fingers, and you have to feel that one. If you have a scapula, then you will understand easily. Now, this one is the superior border of scapula. This one is the medial border of scapula, and this one is the lateral border of scapula. Now, come to the superior border of scapula. Superior border of scapula, as you can see, one notch is present at the superior border of scapula. See, are you seeing the one notch is present at the superior border of scapula? That notch is called superior scapular notch. That notch is called superior scapular notch. On that notch, on that suprascapular notch, one ligament is present above the suprascapular notch. Suppose this one is the suprascapular notch, and above that one ligament is present, that is called suprascapular ligament. That ligament, due to presence of the ligament above the suprascapular notch, that forms the suprascapular notch as a foramen. As you can see, this is the foramen, and this foramen means inside through that foramen, suprascapular nerve, suprascapular artery passes, and above the ligament, suprascapular ligament, suprascapular artery passes, and below the suprascapular ligament, suprascapular nerve and suprascapular vessel passes. Okay, now again come to the superior border. At superior border, one more muscle get attached, that is omohyoid muscle. Omohyoid muscle, omohyoid, omohyoid muscle get attached. Now come to the guys lateral border. Lateral border is the thickest border of the scapula. As you can see, if you have the scapula in your hand while reading, you can see the lateral border is the thickest border of scapula, and superior to the lateral border, you will see one notch is present. Lateral border, you will see one tubercle is present. That tubercle is called infraglenoid tubercle. That tubercle is called infraglenoid tubercle. Infraglenoid tubercle give the attachment of tendon of long head of tricep brachii muscle. Okay, now come to the medial border. Medial border is the sharpest or thinnest border. Medial border also give the attachment of total 4 muscle. First muscle is the serratus anterior. The serratus anterior means, as I say, the serratus anterior. What do you feel? I will say anterior means anterior portion. Yeah, are you right, guys? And it means the serratus anterior muscle present on the anterior surface of the medial border. Okay. Now come to the second muscle. The second muscle present on the medial border of the scapula is the levator scapulae. What is levator scapulae? Now come to the third muscle. Third muscle is the rhomboid minor, and the fourth muscle is the rhomboid major. Now come to the guys angle of scapula. There are 3 angles of scapula. I told you earlier. First angle is the superior angle, second one is the inferior angle, and third angle is the lateral angle. Their glenoid cavity present. Now come to the first angle, that is superior angle. Superior angle forms due to the how I can say like that, the superior angle formed due to the joining of the medial and superior border, that is called superior angle. Okay. Now come to the inferior angle. My scapula is a little bit get degenerated, so the inferior angle looks like little bit more fuzzy. But if you have a new scapula, then you can see on that one, and the inferior angle will be you will be easy to see the inferior angle. Now you can see this one is the inferior angle of scapula. At the inferior angle of scapula, it lies at the 7th intercostal space or at the 7th intercostal vertebrae, at the level of 7 intercostal space or at the level of 7 intercostal vertebrae. Okay, now come to the lateral angle. At lateral angle, glenoid cavity is present, and glenoid cavity gives the attachment of the head of humerus and form the shoulder joint. And the lining of the glenoid cavity is called labrum. This lining is having the attachment of one cartilage. Okay, now as I told you now, at the lateral border of scapula, one tubercle is infraglenoid tubercle. That means the tubercle present inferior to glenoid cavity. In the same way, superior to the glenoid cavity, one more tubercle is present, that is called supraglenoid tubercle. From the supraglenoid tubercle gives the attachment of the one muscle. That muscle is the bicep brachii. It gives the attachment of the long head of the bicep brachii. Now, this is the spinous process. Spinous process goes laterally and upward, and it forms the acromion process. Acromion process is the outgrowth or the extension of the spinous process. It forms the at the acromion process. You will see the one articulation surface. Are you able to see this articulation surface? Nothing but here the clavicle got attached and form the claviculoacromial joint. Okay, now one ligament also get attached at acromion, that is coracoacromial ligament. The ligament present between coracoid and acromion is called coracoacromial ligament. Now, one muscle also present at the spine of scapula, that is trapezius muscle. Now guys, I forget to say, right now I'm saying that as you can see at the just beside the glenoid cavity and the spine of scapula, we see one notch is there. This notch is called subscapularis notch, and from this notch nerve to the subscapularis muscle and vessel passes through this notch. That is called, from this notch or from this area, you can see from this area nerve of the subscapularis and the subscapularis vessel and subscapularis nerve passing through it. Now guys, I have completed the scapula. I know a few of the points get left, but I will make another video also. In that video I will complete all that part that left. Okay guys, we will meet in the next video. तब तक के लिए बाय, मिलते हैं.